So if you're on the Medicaid program, do you even need Medicare? Well, in today's video, I'll answer a question that I got from one of my viewers in my video, Medicare versus Medicaid, where he asked, do I even need Medicare if I already got Medicaid? And in this video, I'm going to answer that question to his specific kind of circumstance, and I also go into kind of the reasons why, even though while you're on Medicaid, you might think that's all you're going to need, you will most likely have to sign up for Medicare anyway. And let's go over those kind of scenarios in today's video. Let's get into it. All right, so first and foremost, bare basic knowledge. Medicare is a federal-based health insurance program that is managed and monitored by the federal government. Medicare Parts A and B are entitlement programs that are based on several qualifications. One is age, the other one is medical. So if you have a type of illness, ALS specifically, end-stage renal disease, kidney transplant, and things of that nature, and there's this list here, then you will automatically qualify for Medicare. If you're on Social Security disability for 24 months, you'll also be automatically qualified for Medicare. But if you're on Medicaid, like, why do you even need it, right? Because Medicaid already pays for all of your medical expenditures. Well, let's take the qualification via those medical kind of costs: ALS, kidney transplant, end-stage renal disease. Because those costs of those types of medical services related to those diseases are so expensive, that Medicare kind of makes it easier for the burden of this cost to be passed on to the federal government, to have like the social catch-all, the social net of medical services cover those medical kind of ailments, right? So that's kind of why Medicare qualifications or eligibility is set forth in this manner. Now, for those of you folks who are on Medicaid already, many times Medicaid will pay for your Part A and Part B premiums if you qualify. And I'll go ahead and show you folks here. There is a list of the different types of what's called MSP, that's Medicare Savings Programs, where the state will actually pay for Part A premiums, Part B premiums, and sometimes part of the co-share that you would have if you're not what's considered fully Medicaid eligible. Now that's the medical portion. What about the age portion? When you're 65, you qualify for Medicare, and you get Part A premium free if you work those 10 years and paid into payroll taxes, and then if you're not working, you can get Part B. Now, here's the unfortunate part. Medicaid qualifications change if you are 65 years and older or disabled. Medicaid qualifications change. So it's a different, unfortunate set of rules when you're working and when you are retired. Some states who haven't expanded their Medicaid coverage still use the same rules for Medicaid for those who are below 65 and over. And the primary difference between getting Medicaid and Medicare, or getting Medicaid when you have Medicare and having Medicaid when you're still working, is the income requirements are much less strict, and also the asset requirements are most likely not there. For example, someone who has a savings or a retirement account when they're working, Medicaid doesn't look at that retirement account and say, well, you still have more than $2,000 in your retirement account. We're not going to give you Medicaid until you burn all that up. And it's very beneficial, because if you have let's call it $100,000 401k, if you took all that out to pay for your health insurance premiums, you'd have to pay an early withdrawal penalty and taxes on all of that money. And the federal government would rather you save that money, and such the federal government pushes money into the Medicaid program to cover you when you're either not working, or maybe you're working at a part-time job where you don't make enough money to really qualify to buy a health insurance plan or a plan from the ACA. So if you're 65 and older, or you're turning 65 and you have Medicaid, you probably will lose your Medicaid eligibility. Now, if you are someone who still will have Medicaid eligibility, do you need Medicare when you're 65? Yes. And at this point, if you are still eligible for Medicaid, then Medicaid will most likely pay for your Part B premium. Now, the qualifications, income and asset wise for Medicaid can be found here. It is state by state based, but I look at it this way. If you make less than, I'd say, around $1,000 a month and you have less than $2,000 in the bank account, you'll qualify for Medicaid even with Medicare insurance, and Medicaid will probably pay for all of your Medicare expenditures. Like if you don't have enough Part A work time, your Part B premium, they'll pay for your Part D premium, and then you can join what's called a Medicare Advantage D-SNP plan, or a Medicare Medicaid plan, an MMP, or an FNP, which is a full dual plan. All these types of plans integrate both Medicare and Medicaid so that they work together. Remember, Medicaid is state run and typically has insurance companies that run it for them. It's not like Medicare where you can stay with A and B. For Medicaid, you have to join one of their Medicaid plans, and typically those Medicaid plans will have a Medicare Advantage plan to go with it to further integrate your care, because a lot of times these dual plans have, number one, additional benefits included in it, and it makes it easier for them to get services for you. Because normally if you just have Medicaid in Parts A and B, Parts A and B will pay for the medical service required and Medicaid pays kind of the rest. But the way that the system works is if you see a Medicare provider and that Medicare provider doesn't accept the Medicaid plan, you will still, as the member of the plan, have to pay the difference between what Medicare paid and what you would have, or your Medicaid plan would have paid for you if you had the integrated plan or a Medicare Advantage plan, or if that provider accepted Medicaid, which not all providers do. So a lot of times, even though I don't like Medicare Advantage, a lot of times I will forego that kind of bias and say, hey, for people who are on Medicaid, Medicare Advantage might be a good place to go to, because the Medicare Advantage plan has things like healthy grocery card, where you can get $100 of grocery items from the store, healthy food items, probably things you can buy with like SNAP, or that's like food stamps, or I forget it, but whatever they provide to like healthy food for young mothers, right? That kind of benefits. You can get over-the-counter medications for like $300 credit to use every 3 months. You can get free dental. All of these things can be included in these more comprehensive plans, and even though they do restrict you, it kind of helps in the case of financial resources, where they give you a little more guidance on who you can see. They will ultimately, as Medicaid being the kind of constraining arm on your care, they're the ones that actually will be providing a lot of the more high risk medical procedures, especially for those who are frail and are kind of food unstable. They might require a little bit more work, like a social worker, an RN to go to the house. Those types of things will be a little bit more seamless or flow better with one of these dual SNP plans. So that's the only reason why I would even consider talking about it. Now, in the case of the comment, we kind of went all through a long kind of roundabout tangent to get here, but he has, or she has, a kidney transplant kind of candidate. Kidney transplant is one of the things that Medicaid is an automatic cover. So if we look here, for end-stage renal disease and the possibility of transplant, then Medicare will pay for it. And if you're on a group plan, at least up until right this very moment, unless they interpret the law differently in Congress, your work insurance is supposed to cover it as a primary insurance, and then Medicare will pay as secondary insurance if necessary. And that's for 30 months. And if it's 30 months they've been there, then Medicare will become primary if the person is still working. If they're not working, they can be on Medicare 4 months after they start dialysis. And then these are kind of the qualifications here. If you do at-home dialysis, you can be qualified even sooner. And Medicare savings programs are here. So where is the... Here we go. The 4 different levels of qualifications. I'm going to close these all so you can see them better. There's the QMB program. This is like the ultimate program. You make less than $11.50 per month. The program pays for absolutely everything. A, B, premiums, deductibles, co-insurance, co-pays, everything that pretty much Medicare pays for. And you will have no real costs for medications. Well, $4 at most for 2022. Anytime somebody charges you for a bill for Medicare, you will let them know that you are in the QMB program and you can't be charged for any of those things. So it's a pretty impressive program. Again, it works if you have Medicaid, you're in this program, you're in at least one of these 4 levels. For people who are still working, this is the Qualified Disabled and Working Individuals program. So this one actually only pays for Part A if you do require Part A premiums, but pretty much doesn't really do much of anything else other than pay for hospital care. So it's not that impressive. But the QI program is, if you're making under $15.49, and for this program they do help with your Part B premiums, so you would be able to get some additional help for those of you who are on Medicaid and you might not have that same kind of plan. So while your plan might not be as comprehensive as Medicaid, usually you don't have any copays or anything, you will be able to get some help by having your Part B premiums paid for, so your insurance cost will be close to zero with you having to pick up copays and co-insurances when you are on Medicare. And then at this point you'd have to choose either a Medicare supplement plan, but at this income level I would say it's probably going to be difficult, or you pick up a Medicare Advantage plan, and again at this income level Medicare Advantage plans might be the way to go, simply because just have a good relationship with your doctor and kind of work within the network. It's going to be a lot easier if you're in a metropolitan area, like an urban kind of city area, versus like a suburban or a rural area, because Medicare Advantage has a lot harder time getting specialists and things in less developed areas of the country. So then that does depend on your individual kind of scenario. But I would definitely say try to think about how your care is and what the reasons for being told you're being enrolled into Medicare, and then from there find out if it's necessary, because you can always deny being enrolled in Medicare. But if you do deny being enrolled in Medicare when, like, let's say you have ALS, Lou Gehrig's disease, or you kidney transplant, there's a chance that the Medicaid program might turn around and say, hey, you should apply for this, we're going to pay for it, you're not going to lose any benefits. And if they do tell you stuff like that, make sure you get it in writing and talk to somebody there, because the rules change and plans. For example, the Medicaid plan may have a rule there that says, yeah, if Medicare covers it, we don't cover it, because at this point you are eligible for Medicare, and because you are eligible for Medicare, which is an entitlement program that you're entitled to and qualified for, the Medicaid program won't pay for it. So if those are different between states and between plans. So it's not something I can broadly answer, just some general kind of things you should ask yourself before you go and say no Medicare for me because it's not free. I'm going to stay with Medicaid forever. I hope this answers kind of some of your questions. I know it's not an easy topic to kind of talk about, especially with Medicaid being a needs-based program, and you can be kind of, uneasy or uncomfortable talking about it. But please, if you have any questions, my Medicaid video gets like the most views on my channel. I would make more, I just don't know what to talk about. So if you guys have any questions, do let me know, ask those questions. I'd be more than happy to get back to you with what I know and what I can find. You guys have a great rest of the day, and I'll see you in the next video.